Okay, so the conduction system. Let's look at what we just talked about on the previous slides. Let's follow what happens. Right here, they're showing us the SA node. The SA node is the pacemaker. It will set the firing rate, and that means it'll set the heartbeat for the heart. Now, when the SA node fires, it spreads through the right atrium and it spreads to the left atrium. Now, when the SA node fires, we get some excitation in this right atrium, and it excites this atrioventricular node. From the atrioventricular node, we're going to find that excitation, that potential, okay? Notice how it's following what looks like they refer to as these nerve-like fibers. This AV node, after the SA node fires and the AV node fires, it travels by way of these little nerve-like fibers. And at this point, we can see that we have the branching. We have the branching that goes along the right side of the heart, and we have the branching that goes along the left side of the heart. And in this area right here, this is termed the bundle of His. We begin to see the branching take place. As the branching takes place, we find little other branches coming off of the big branch, and those go into the myocardium, those cardiac cells, and these are our Purkinje fibers. So the SA node fires, we'll have the AV node fire. It will travel by way of these bundle branches and spread that excitation along the myocardium. And so when the heart beats, it looks like it does this twisting motion. Oops, sorry about that, you guys. I hit the camera thing. It does this branching, okay? Because of the branching, it makes it look like the heart will go ka-ching or koosh or whoosh, okay? But really, that heart beating, that is all of those cells working independently and passing that electrical potential. That's how quickly it occurs. Now, the heart beating does not depend on the nerve system. But if you remember, I've always said that the heart is innervated. So what we're going to find is that we do have sympathetic fibers to the heart. And if you remember, the sympathetic system is for fight or flight. So it's going to increase the heart rate as well as the contraction strength. So what we're going to find is we get the fibers that make their way to the heart, and the fibers of the sympathetic nervous system, note where they terminate. They terminate in that SA node and the AV node. They'll terminate in the myocardium, okay? And some of them can be found in the aorta, the pulmonary trunk, and the coronary arteries. When we have this sympathetic nervous system kick in, its job increase heart rate and the strength of the contraction. The parasympathetic system, now remember, the parasympathetic works in opposition to the sympathetic. So the job of the parasympathetic slow the heart rate. Now, once again, the fibers, the nerves that are going to make their way, note this good old vagus nerve, okay? And the job, okay, note that the right part of the right vagus nerve goes to the SA, part of fibers to the left lead to the AV node. We don't have hardly any connection for the parasympathetic to the myocardium. It simply goes to the nodes. And if it goes to the nodes, it's affecting the firing of the heart, the firing of those nodes. And if it can slow it down, therefore, it's going to slow down the heart rate as well as the contraction of the heart. The activity, the electrical and the contractile activity of the heart. When the heart contracts, that's going to be termed systole. When it relaxes, that is diastole. And we usually think of this with blood pressure, like when we're taking the blood pressure numbers. Yes, blood pressure is a result. So when we take blood pressure readings, it is a result of this contraction and relaxation. Now, as we look at this contraction of the heart, when the heart is in a normal rhythm, it's called the normal sinus rhythm. We're going to find that that SA node, which is the pacemaker, is functioning to set the pace of the heartbeat. This is usually about 70 to 80 beats per minute. Sometimes we can have what's termed an ectopic focus. This is where another area besides the SA node will determine the beating of the heart rate. So if, for example, the SA node is damaged and we have to depend on the AV node for the beating of the heart to set the pace, the heartbeat slows down significantly. Because the AV node, that can only set a pace to about 40 or 50 beats per minute. If the SA node or the AV node cannot set the pace of the heart, it slows even further. It actually slows to a point where it doesn't sustain life. So, when that type of situation begins to happen, this is when people usually need to get pacemakers. They tend to have problems with the heart beating. They'll probably most likely be in the hospital, that sort of thing. So this SA node, this physiology of this pacemaker, do you guys remember how we talked about the potentials? This is no different, okay? Just like we saw with skeletal muscle and nerve tissue, the nerve cells, we are working off of an action potential. So we're going to have in this organ, in this pump, the resting membrane potential, because when we talk about the passing of the ions, that was electrical. So we're going to see that we're going to have our potential reach threshold. And when it does, note this time, we're opening some calcium and sodium channels. Potassium is still involved, okay? But calcium is very important to the beating of the heart. So when we have the action potential this time, we are looking at those ions, calcium, sodium, potassium. and we have the action potential get started, and then we have to go through the cycle of depolarization, repolarization, recovery, and we have to make sure this occurs for every heartbeat. So on a scale of the heart beating, that SA node and this action potential where we have to depolarize, then repolarize, recover, and start all over, this is having to take place about every 0.8 seconds. So this electrical potential is much, I wouldn't say faster, it's different. Okay, it's going to be different than skeletal and nervous, but a big difference is we need for there to be recovery between every heartbeat. Something that we probably don't really think about when our heart beating, okay? We probably think about the fact that that heart beats all the time, whether we are really paying attention to it or not. We probably don't think about it actually needing a relaxation. So when we have these signals, these potentials occur, that SA node, note how long it takes, roughly 50 milliseconds to go from the SA node to the AV node. From the AV node down through the bundle and the Purkinje fibers, only about 100 milliseconds. A majority of the time, because those were milliseconds, and if it's beating at 0.8, a majority of it is being done, believe it or not, for recovery. So we get the signal traveling through that AV bundle. We're going to have it go into the Purkinje fiber. We're going to then have to have that contraction, or what we think of as the heart contraction. The heart contraction actually begins at the apex of the heart, where it looks like it does this twisting motion, just like it says, like you would just wring out a wet towel, and it would just do this twisting motion all the way up. And when it does that twisting motion all the way up the heart, basically what's happening, you're seeing it push the blood from those ventricles into those great vessels. So that signal that's passing, okay, it's going to be carrying the signal quickly, but at the same time, we have to make sure that those cells have the ability to recover. So the actual depolarization is very quick, but note the actual plateau is long. The reason that the plateau phase, basically once we depolarize, we get to an area where normally we see a peak go up and go down, okay? This time we're going to see the peak, and it'll actually level off for a couple, well, not even a second, these milliseconds, before it drops back down, going into repolarization. That lag that we have after it reaches the peak, that is the time that we actually are allowing or getting the blood expelled from the heart. So this this contraction that takes place, okay, we're going to find after we get that plateau phase, we're going to see the repolarization, and then the refractory period, that recovery that needs to take place. It will occur, okay, and it lasts much longer than what we see in skeletal muscle. And the reason for that, we can't in any way have the heart go into tetanus. If you remember anything about tetanus, The last thing that is, or that we need in the heart muscle, is for that muscle to go into tetany and stop working.